Can you please state your name and your position here at Friend for Life?
My name is Wanda Dudley, and I'm a Kent School student to get my Master's of Social Work, Psychosocial Oncology, and so I'm doing a practicum for the year with Friend for Life.
I'm Nicole Guffey-Wiseman. I'm Assistant Director at Friend for Life, and I do a little bit of everything here.
And I'm Judy Casey Hewlett, and I'm the Executive Director of Friend for Life. Sounds very fancy. And I've been with Friend for Life since 1999 to talk to.
What services do you provide?
What Judy was talking about is primarily the main service that we provide, the matching with the newly diagnosed patients with a survivor that's been through a similar diagnosis. We also have a few other programs, things like talking with the medical students and nursing students at U of L, and also Galen nursing students. And that's our volunteers talking to the students about kind of the patient perspective, going through a cancer diagnosis, specifically about communication. So whenever you've been diagnosed, the things that your doctor can say or do that can be helpful for you or detrimental, that kind of thing, in dealing with the diagnosis. Those are the couple main things that we do. We have a few events throughout the year, but that's most of it.
What is the most difficult part of your job?
There are many difficult parts. There are many really wonderful parts. I would say for me, if we have trouble matching someone, but especially when we get calls for people who have financial needs, and there's a lot of that, and it might be that they don't have any financial resources, or that they're falling in between the gaps where their insurance doesn't quite cover what they need, and it's the day-to-day stress. So that's difficult because that's not really what we do. So we try to link them with other resources. There just aren't enough. I don't know if you all have any additional things that are hard.
So just being able to support people when they have so many other things going on, and just the sheer amount of people that are diagnosed with cancer, because it's either about 1 or 2 or 1 in 3 people have cancer at some point in their life. So it's pretty much impossible to not find somebody that's not affected, whether it's directly themselves or somebody that they really care for. So just being able to provide for all those folks and make sure that they get what they need can be tough.
What do you feel is the least understood thing about the people you serve or the people you work with?
The one I came up with for this was sometimes people will confuse us with hospice or hospice. They think if you're dealing with people with cancer, you're dealing with people who are going to die, and obviously everybody's going to die. But our volunteers are survivors, and they're focusing on carrying on with life. And we have 300 survivors or close to that. So it doesn't, cancer used to be seen as a death sentence, and a lot of people still see it that way, and it's not.
Who do you feel has the power to change this situation?
I think we do. I think technology, doctors have gotten better with it. As a social worker, University of Louisville is the first college to have social workers that have a specialty in oncology. And so I think we're becoming more knowledgeable about cancer. We're also catering to the patient instead of just the cancer. We're looking at the patient itself, not just the cancer, but seeing how we can help you deal and live with cancer.